welcome back to Treatment Tuesdays. Today we are going to talk about the silent culprit. I have the elbow pain workshop happening this Friday, November 15th, and so our focus has been on elbow this last month, and the silent culprit I am talking about is the external rotator of your shoulder. So this is part of your rotator cuff, and there's some newer research out there that supports the fact that when you have elbow pain, particularly lateral elbow pain on the outside, as well as that medial pain on the inside, one of the main contributing factors can be weakness coming up from your shoulder. And so there's tons of ways to work on this. The first one being super easy, just bilateral external rotation. So you get some TheraBand, like your forearms are sitting on a counter, so your elbows are bent to 90 degrees. I'm thinking of squeezing my shoulder blades back. My wrists need to stay neutral because we don't want to irritate our elbow. And all I'm gonna do is pull apart, squeeze my shoulder blades together, and come back. Okay? You're shooting for like 20 of these. If it feels okay, you can speed it up a little bit, just be in control of the band. So that's probably the easiest way, not the most effective to target the infraspinatus or that rotator cuff muscle that causes that external rotation. The second way would be good old-fashioned sideline external rotation. So this is a hefty 2-pound weight that we're going to use. You would get down on your side. Often you can put a little rolled up towel underneath your arm here, but once again you want your elbow bent to 90 degrees. I'm going to start down with my hand close to my belly button, and I'm rotating up to the ceiling as far as I can pain-free, and back down. Once again, we don't want to cock our wrist back. You want to keep your wrist as neutral as possible. If this bothers the elbow, you could wear a wrist guard or something to hold the wrist a little bit more neutral. And same thing, you're just going to fatigue, so this might be 15, it might be 50. Okay? The next option would be external rotation with the band. So once again, elbows at 90 degrees. From here, I'm rotating out. You can see that I have to go a little bit of a diagonal to keep that 90 degrees in my arm. Now, if you start to feel it in the elbow, you can try and take your wrist out of the equation by just looping this around your forearm so that we aren't using our hand anymore and doing the same thing. Okay? But the exercise that shows the most recruitment specifically from the infraspinatus in our rotator cuff, which is this silent culprit we're talking about, is a version of sideline. So once again, you're going to get down on your side. My arm underneath is going to be out at shoulder level, and I'm going to bend it up to support this arm. This arm is going to rest on this. Now if this feels pinchy or anything, you can bring it down just a little, but you want it as close to shoulder level as you can. And then I'm just rotating up towards the ceiling and back down. So once again, my elbow is at 90 degrees. My wrist is neutral, so I'm not trying to get more motion by bringing my wrist up, keeping it nice and level. And same thing, you're just going to fatigue here. So those are multiple versions of phase 1 of rotator cuff external rotation strengthening, which can affect your shoulder as well as your elbow. We would progress this as we go, and obviously there are much more important things to address in the elbow prior to this. And if you are interested, I suggest you come to my elbow pain workshop this Friday the 15th from 12 to 1. All right, thank you.